All right, when you hear that tune, you know it is time for us to get talking about our health. And yes, I may sound a little wonky, but hey, when it comes to health, I am one to preach, preach, preach. And trust me, I've been on all the meds, not necessarily meds, but I'm just taking the right things to make sure that I'm in tip top shape. And it is so important to talk about our health. Thankfully, today we'll be talking about safe care for all patients, but we'll focus more on newborns and children. Well, as always, I'm not a doctor. I like to clarify. And I will not be having this conversation alone. Yes, indeed. Thankfully, I have Dr. Tobechi Ozuzu with me in the studio. He is the Quality and Compliance Manager at Reddington Multi Specialist Hospital. Good evening.
Good
Glad to have you
evening.
as always.
Thank you.
Yes, 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 Regals. As always, to be a part of Smooth Health, what you can do is share your questions, thoughts, contributions. WhatsApp is the platform 0911 999 0981. Yeah, you have that? Good, great. Oh, so I know that World Patient Safety Day was a few days ago.
Oh, yesterday actually.
Oh, it was particularly yesterday.
Yesterday, yeah,
Why did I think it
17th,
was
yes.
Monday? Anyways,
It
yeah, I
was
confuse
17th.
dates sometimes, but
Yeah.
yes, it's an important conversation to have. As patients, you just go to the hospital, you don't even know anything. You just go. Most of the time, one of the reasons why most people go to the hospital is, oh, doctor, I've been trying to treat something, it's not going. That's the only. It's usually emergency purposes they go. Some people don't even like to go in for regular checks.
True.
And even whilst they go, they don't even know what it is they're supposed to be asking.
That's why we're here.
Thank you. You have the right people. Always. And talking about that, I know this year's theme for Patient Safety Day is surrounded around children
Yep, and the
and the
newborn especially.
newborns.
Yeah.
So talk about that.
Okay.
But talk it holistically about World Patients Day, so a World Patient Safety Day. So I like to start with that. I like
Okay.
to give us insights,
Of what
breakdown.
it is. Okay.
Yeah.
So when you talk about what patient safety day, so primarily what any healthcare provider should do is to do no harm. So let's say you walk into the hospital, you should walk out better, not worse.
I
That's
agree
key.
with you.
Walk out better, not worse. Now, basically, what patient safety day is, how do we make sure that the patient receives the proper level of care
Okay.
and is able to communicate that to us through several initiatives? For example, infection control initiatives, clinical compliance, risk management, incident management, loads of plethora of things for them to do.
Oh,
But
wow.
basically, what we need to do is to make sure that the patient comes in, doesn't carry any infection, doesn't fall sick, doesn't have any surgical site infection, doesn't have a whole lot of things. So basically, what do you do to prevent this woman or this man from having anything other than what they have? So let's give you an example. So you have a lady, I always say, comes in pregnant,
Right.
and 9 out of 10 times, oh, she gives birth and she goes. But most of the time, so let's say, for example, the liver is difficult. Do
Mm.
you have a theater ready for a cesarean section? Let's say she needs blood. Do you have blood group and
Oh,
cross-matched and kept? Do you
okay.
understand? Do you have a pediatrician or call? So all these little things
I think you
are
need to put in
things we need
place.
to put in place to make sure that once this woman comes in, no matter what obstacle she faces, she goes home safe with her baby.
And you think that these things are insignificant, that you never want to be caught off guard. You
Exactly.
never want to be caught off guard.
Exactly.
So I will always say, as a patient, always ask questions. No matter how, if they're giving you medicine, ask.
Because you're right. It's your right to
Some
know
people will tell you,
everything.
is the doctor say no best?
Yeah.
Ask. And if you need clarification, please find out what they are. Second opinions are also allowed.
True.
I know
True.
that certain people will say, oh, when you go to the hospital, that's it.
No.
We shouldn't. No,
You're
please.
entitled to receive care from someone. You're entitled to say, I don't want to talk to this doctor or nurse. I want to go to another hospital. And then the hospital you're currently on can arrange all your records, lab investigations, whatever, and give to you and then take you there. It's your right.
We're in Nigeria.
Serious, it happens. So because patients don't understand what their rights are, you
Right.
end up having such um, issues. Once you understand that your entire okay, let me give you an example. Let's say a doctor misdiagnoses you or a nurse or something happens, and then you take them to court. What they will use to determine whether the doctor did the right thing. It's from your records.
Right,
You understand?
right.
So it's yours. It's your documentation. All right. So you can afford to demand it, and they'll give you everything from the moment you came
You
in
came
to the
in.
moment to the last thing. They'll just give you everything, and then you can.
Oh, okay. So at least now you have that. In case you didn't know, now you know. So let's talk about the theme for this year: safety for newborn and every child. When we say safe care for children, what does that really mean in simple terms?
Okay, so let's break it down. So as an adult, if you have a headache, what do? You you say
Obviously,
you have a headache, you tell
yes.
the doctor,
Mm-hmm.
but the kids can't communicate.
Oh,
Remember.
yes,
So
yes.
basically what safe care is from infancy, even while in the mother's womb, so when you come out, so when you get to a sizable age, what can the hospital do? What can everyone do to protect you? Let's say, for example, while you're in the mother's womb, when the fetal health cells checked,
Mm-hmm.
you understand?
Mm-hmm.
When you're giving birth, there was the ABCA score done. Were you examined? Were you checked for neonatal jaundice? Were you giving your vaccinations at that age? Because all these things are important.
Mm.
Where was the mother told about the importance of breast milk, putting to breast? Was because colostrum is the most
Isn't.
important, breast milk the child can take.
Right.
Was she educated on that? Was she educated on hygiene? So
Mm.
these are things that cut across the care of the child. Did you come back for a follow-up? Did you come back for a follow-up vaccinations? Were you told how
Okay.
important
Those
vaccinations are?
vaccines. Oh.
Exactly. Were you taught on how to observe signs of neonatal jaundice or any other thing you may have to see? Step by step. But these things are important. But the problem is that a couple of times people tend to overlook them. Oh, okay, you're giving birth and you go. No, that's
I'm
not it.
fine. Hey,
Yeah, and that's why you see them.
Hebrew woman.
That's why you see. After they're giving birth, 3 or 4 weeks later, they come back and they
Crystal
say,
is
"Oh,
like something's
there's a."
wrong.
So the question is, were
Ah,
those things done?
okay.
Do you understand? So
Okay.
that's it.
Ooh, a lot to unpack. A lot to unpack. But with having those background knowledge,
Okay.
right?
Okay.
What are some common dangers that newborns and small children face both in the hospital and at home?
Okay. I think one of the primary ones is sepsis. It's you have infections because remember these are kids that while they were in the mother's womb,
Right.
um, the immunity tends was like protecting them. But
Oh,
now that they're
yes.
outside, they're facing a lot of things that were not encountering outside. So hygiene is one of the most important areas you need to look at. So sepsis, neonatal jaundice, those things are what they are prone to. You end up seeing them, having difficulties, like having pain, having this. Those
Mm,
things are things you pick out from. So
mm.
that's why it's so important that mothers are educated just by cleaning the
Umbilical
umbilical
cord.
or cord just by taking care of the child. It's so important. Like those things cannot be overemphasized.
At least
That's why
now
you
I know
see.
that you should not use that back.
So exactly all those practices back then that you said, notice that place is so different. Those are the things that you understand. So
And then
it's
you
so
come even
important.
heavier from the lack of knowledge
It's
that.
it is so important. That is why antenatal classes, even people even they even tell you, even after you've given birth,
Mhm.
come back to ask questions and because this is how this is how in as much as you may have yes, of course, you have the support system around you, which is good, but they may not understand what is going on. They may not understand how to better help you take care of your child. So it's so important that you liaise with it has to be a family thing. You have to treat the hospital,
Right.
especially your antenatal care, as a family. That's why when you see women that go for antenatal care, they
Oh,
always go together. They always that because they share ideas, they share, so it's so important.
Hmm. Interesting thoughts. Well, Lagos, as always, don't forget you can be a part of this conversation. Men, tell your women to come close so I can learn. Let men also you need to learn so you know how to help your wives, yeah, and intending husbands. Learn this so it's not something new. When they're talking, no, I know this, I know this. It helps. All right, let's get further. So now we know that once it comes to care,
Yeah.
I hear wash your hand, wash your hand, wash your hand. It's
Very
not a
important.
joke.
It is not. It is the primary source of infection. See,
These
if
hands.
if you can wash your hands, I'm talking about you on a daily basis,
Mhm.
about 3 to 4, 5 times per day, like wash your hands properly, like the level of infections you could get could be drastically reduced. Because this is basically the source of it. Like everything you're eating, you're touching, you're doing this, you're doing that. So important.
Your hand.
Your hand.
Okay, so let's talk about you spoke about certain things that one can do.
Yeah.
Now, is there any particular example you could give regarding mistakes or problems that could be avoided if one actually takes proper care, especially where children, babies and children are involved?
Okay. So like we spoke about earlier, hand hygiene is key. You do not overemphasize it because at the end of the day, remember loads of people carrying that baby that
You
you
see
don't
that
even
thing,
know.
eh? See that thing? I, I I would like to understand. So I go and visit a mother who's
Yeah.
just given birth.
Yeah.
Is it? Can she also say, sorry?
Yes, it is her baby. It is not your baby. She can afford to say sorry. No, no.
Because everybody
Just
feels
imagine.
bring the
Yeah,
newborn down. Let me carry.
just imagine what you're exposing that child to. Like, let's say
Right.
6 or 7 people coming from the market. You not wash your hand, no hand hygiene. They just grab, and then maybe the child will put your hand in his mouth. Do you understand?
And baby, you don't do any better.
Do you understand? And then the child falls ill, and you're like, where
Running
could this child have
helter
gotten this?
skelter. You don't know who's
You don't know where
probably
the hands have
played.
been. You don't know what I mean. No.
Okay. Very scary stuff. As parents, you need to protect them because they can't protect themselves. They just, whew, I'm just scared just thinking about that. Very, very, very kind of situation. But Lagos, these are the reasons why we have this conversation. It is to better inform you so you're not caught off guard. You're not wondering if that is something that you've made a mistake about.
True.
Well, thankfully, we have the doctor in house and he's shedding more insights. If you have questions, you have contributions, 0911 That is the WhatsApp number to ask Shagel Foods as we journey along. Okay, so I know that as a parent, I'm not one, but
Okay.
I at least I'm a second parent.
An assistant parent.
Yes.
Yes.
So you've spoken about how it is from hospital to home,
Yes.
and there's certain things where you're trying to help out, especially for first-time parents.
Yes, please.
You're now trying to help out. Is there anything that you could do as an individual that could be a problem without you even knowing? Talking about feeding, talking about sleep, hygiene, all those things. Are there things that one could do that could trigger a problem?
Yeah. So let's talk about feeding. So one of the things we let people know is breast milk is the most important source of nutrition for a baby after 6 months. And people will advocate for, I strongly advocate for exclusive breastfeeding for 6 months. But then you now have mothers who do not want to comply. Yeah, we understand that sometimes people want to use breast milk substitutes and all, but the question is, how are those things constituted? Who taught you how to do that?
Right.
Do you know if this is harmful to your child? Have you sought for advice? You don't just try anything willy-nilly on the baby. You have to understand that, will this have cause complications with my child? Will my child be able to digest it? Will this have issues? So these are the things you have to look into. It's not just trying different trends. You see people trying different things. Oh, I want to feed my child this. No. That's why the medical personnel are there. That's why, see, one of the most engaging, because I tell people, one of the most engaging classes are your antenatal classes because you see mothers talk about things. You see, based on the health perspective, they share ideas. All those things, because at the end of the day, you are a new mother who is, I mean, you just have a baby and you don't know what to do. You understand? Even though you don't have guidance, but it's always nice. That's why those classes are interactive because they put you through all you need to do and you don't make those mistakes because those areas are key. You have mothers, yes, sometimes I won't, to be quite honest, they'll tell you they find it difficult to put to breasts. I don't know. So the question is, what have you done? What have you done to improve that? What advice did you take? What kind of meals did you take? Because at the end of the day, what you have passes through to the child. Will what you're taking be harmful? That's why they always tell you, oh, once you get pregnant, don't drink alcohol. It's for a reason. It's
Oh,
not,
yes.
yes, it's not,
because they
yes,
want to
or
have
don't smoke or don't take drugs. Don't, because at the end of the day, these things cascade down to the baby.
All right, Legals, we have a quick breather coming through. So we will take that, but there's so much more to uncover and questions to get into. So, have you ever been a parent where you give the child a wrong medication? See this one, Dr. Tobechi.
They give up. No,
See,
no,
we'll come to that conversation. Lagos, as always, stay tuned. Don't move a muscle. Stay tuned to Smooth 98.1. They're shoving things inside that
oh, they're giving Jap paracetamol or whatever they want to give. Therefore,
no, you're saying paracetamol is good.
so
You're giving the child palm oil. What is that?
but the question is, even giving paracetamol, as much as you bring down the fever,
Right.
but what you're doing is you're masking the condition. So let me give an example. So when the child has fever,
Right.
it could be so many things. It could be malaria, it could be sepsis,
Maybe
it could
have malaria. Yeah.
they're going to the red blood cells and get this.
No, no. So this is me just, because you're supposed to have mosquito treated nets and all
So
that.
all those little things now are things mothers should put into place. And then there's this notion of, oh, it worked for this baby, it can work for mine. It doesn't work that way. Because your baby could react to this. It's so important. Like people don't realize how important it is that at times you must go back and ask.
No, they don't ask questions.
They
So
just
they
go-
tell you,
they just-
"Hey, my doctor said.
Doctor said that no, this and my auntie said this to take this. No, it doesn't always work that way. Person doesn't have the medical level of experience to be able to tell you this. They have to look at the baby, they have to tell you what's wrong. Because even if you're taking that paracetamol, it's masking the condition. So you don't know. So the people go down, but the condition will still be there. That's why I was giving paracetamol 2 days ago, and then the fever came back again 2 days. You've not treated the cause. You're just masking it. You're just,
So what? What is
Smooth health on the drive.
all right? Let's get back in. Oh, you don't wait, guys. It is 34 minutes going past 5. You're still tuned into Smooth Health here in Smooth 98.1. In case you're wondering, my name is Joy here. And yes, if you can see the doctor sitting beside me, he is Dr. Tobechi Ozuzu. He is the Quality and Compliance Manager at Reddington Multi-Specialist Hospital. Glad to have him with me. And we're talking about the World Patient Safety Day. It was yesterday. However, the theme for this year focuses on newborn and children. It is very important to talk about patient safety. There's so many things you overlook as a patient, but even whilst it is important to talk about the things that affect you as an adult, what about those ones that don't even know how to talk, that cannot help themselves, that are very, very prone to all the mistakes that we make? Talking about mistakes. Let's talk about the one we were talking about, even whilst we're off air. In case you see, if you're not on YouTube, you are missing. However, to catch all the behind the scenes, you want to go to youtube.com/Lagos Smooth 91 FM Lagos to get all the behind the scenes and all the interesting things. We're talking about medication, and there are certain instances where it's not intentional, right? I would want to believe it's not intentional that a parent will give a child because explain to me why a parent is giving a child palm oil in the instance where they've given the child the wrong medication. Please walk me through it. What in a situation like that, if a wrong medication is given, what should be done?
I mean, are they looking at giving activated charcoal? So the thing is this.
But there's something about activated charcoal. I know. Yeah.
Level of medical knowledge do you have? Do you even know what the drug? Do you even know whether
from our generation, from the generation?
So you're giving the child palm oil. Do you know if the medication reacts to the palm oil? Do you know it will cause more harm? Do you know what could happen? Are you giving it to flush it out? Are you giving it to take it back in? I mean,
No.
come on. So I tell people first off, you the whole issue of self-medicating, where you because this medication works for this child, or you feel it to work on my child, doesn't work that way.
Okay.
There's nothing wrong with going to the hospital because these people are trained for that. You see, the thing about, okay, let me give you an example. So a child comes down with fever, all right,
Right.
and then you give paracetamol.
Right.
Now, as much as you think that the paracetamol is going to solve the problem, it basically tends to mask it because the true cause of the fever
Fever is not
hasn't been
detected.
established. It could be from malaria, it could be from sepsis, it could be from another infection, it could be from anything. That's why you need to go to the hospital. When you go to the hospital, as much as they're going to give you paracetamol, they're still going to give you something else, maybe antibiotics or whatever the case may be, to take care of what the underlying thing is. That's why when you have this, I have a doctor. I gave them paracetamol 2 days ago, and the fever still came back. Yes,
It will come back
Because
because
it will come
you
back.
haven't dealt with the major.
you haven't dealt with the major cause of the illness, and that's the problem. So for me, I tell people, as much as you may have, yes, the internet has proliferated level of knowledge now, which is understandable, but you still have your. It's true. I mean, everybody, it's not DIY, do it yourself. But everybody, that's why you have people that have been trained for this. You have pediatricians that have been trained, like after the normal medical college, they've been trained like an extra 5 years just to take care of kids. So that's why you go to them. All right, for that.
Okay, we've gotten that as a in that instance. What of in the instance where you have this trained personnel?
Okay.
Could be the nurses, could be the midwives, could even be the doctors
Okay.
that have been at fault. How then do you deal with this? Because when it comes to safety, you're thinking about they should have more knowledge.
Okay.
How do we deal with that?
Okay, so let's start with the before and after. So before, as a doctor, as much as you've had trainings, you're entitled to have to do what you call do trainings. You're trying to do CME courses to improve your knowledge. Because what you learned 4 years ago has
It's not-
evolved. The medications that were effective then has evolved. After you do those trainings on a monthly or my yearly basis, depending on what you want to improve your knowledge. But the truth of the matter is, if there is an issue, if there's a misdiagnosis or if there's a wrong medication given to the patients by the doctor, the onus is on the hospital to let you know. It's not hidden. It's your right to know. Remember, it is your right because you have to also understand your right as a parent. This is my child. Every medication that is given is your right to know. So even an error by the hospital, the onus is on them to come up and say, this is this. You do not hide. The worst thing any hospital can do is to hide such things. It's unethical. All right. So they tell you this is how we can. So the question is, okay, this is what we did. This is the error we found, and this is how we can rectify it. Then you go from there.
Ooh, okay. It's more like Dr. Tobechi is exposing the doctors. I don't know. It would seem like it would seem like he's just telling you, see, if they're not doing like this, you better hold them by the jugular. If not, you will be the one to suffer at the end of the day. And that's not what we want for you. We want the best care for you. And we also want you to have the right information because if as a patient, for children, you're the parent, you're the ones who should find the best solution for them. But as an adult, if you do not know what you need to know, then that is also on you. We've talked about I don't want to make it look like it's highbrow, lowbrow, or the low. But let's talk about rural areas.
Okay.
You have these rural areas that do not have big hospitals, but they have midwives, they have nurses. Let's not talk about the situation in Nigeria, right? It's scary. But how can community health workers actually help where children's safety is?
Okay, so those they play a huge role because they interact with those mothers who are expectant. They come in towards the antenatal period, and they also interact with them after birth. So what the government should do is to train those community health workers on the best practices. Let them know what the basics are with infection control. Oh, it's important to wash your hands. It's important to do this. It's important to understand this. It's important to do that. Once you're able to give them that foundation, they will go around and because the truth of the matter is this. One of the advantages of those care workers is that they've been there done that.
Mm.
They have the experience. They know what happened, but they don't know the scientific backing behind it. So if you're able to explain to them, okay, so this is the reason why you had it. If you tell them to wash their hands for this period of time, if you tell them to make sure they wash their bottles before they feed, if you tell them to do breast milk, you understand? So that will have that. And because they're in the community, they see these women, they go to, as they're walking around, why is the baby calling out like this? No, don't do this. Or I can't give you his bath, or whatever. Don't let him put sand there. Don't do, all those little things. So it's important for the government to educate them, have training sessions, have symposium, carry them along. Because you see, as much as we're saying doctor, nurses, and all, you still have that missing link, especially in the rural areas. Who have that ability to transfer that information to them?
I really hope that there can be things that could help, especially where the government is concerned. I know, like I said, let's not talk about the health sector.
We're improving. We are improving.
Some would say, I know someone did make mention that it's because certain people have access to the quality services, but that's not it. That's why, sometimes trying to reach doctors in certain public hospitals, they are overworked. So getting them to be on air could. This is me just trying to explain why you have certain doctors come in regularly than others. So having those doctors who work in public hospitals is a whole lot difficult because their schedules are really tight. It's a struggle to get them in, but once we have them, we always, share where you can reach out to them and all that. But here's the one thing you spoke about government, and let's talk about the laws. Are there laws or rules in Nigeria that actually protect children in hospital? And it's one thing to have the the rule or law. It's another thing for it to actually work. But are there?
They exist. The laws are in abundance that take care of kids. That's why you have situations where if a child comes in and they examine a child and they see evidence of abuse on that child, they notify the police immediately.
That is as a health worker.
As a health worker. So you come in, okay, a mother or a father brings a child and says, this child is, she fell on the staircase. And then you look at the past maybe 3 or 4 occasions the child has come and you see.
He's saying kind of.
Yes, which point out to an abuse. That's why most of those have ethics committees. What they do is they say, okay, look at this. This is evidence of abuse. What can we do? What do we do? You don't just give the child, because the truth of the matter is, as you're giving the child back, there's a tendency that the child may not come back again. All right. So those laws exist. Although we're still trying to play catch up, unlike Western areas where they do more of this, but it's still in effect. You rarely have how I put it now. The government is trying to, one of the things, I think like was last week or so, they signed a memorandum of understanding with some organizations and to help boost the tertiary institutions to maintain the quality standards. So it's in play. It's a work in progress, but we've not gotten there yet. But we're coming.
At least we have something.
Yes.
It's okay. It's okay. It's something. It's just with time, hopefully, all will be fine.
Yes.
Ooh, it's that time where sadly I do not want to let you go, but before letting you go, it's always a great conversation having, and every time you're coming, you always give great insights. But for any parent who's listening now, who will probably listen again because they can actually catch it much later on YouTube and all that. What are top safety tips they need to be aware of whilst either going to the hospital, at home? What are those top safety tips?
Okay, so as the parents, you have the right to understand what's being done to your child. All right.
Okay.
Most pediatricians understand it, so that's why they carry you along.
Okay.
They tell you this is that. The self-medication and all is discouraged because you think you're doing well for the child, but you're actually doing more harm. 2, hygiene, hand hygiene especially, like we discussed. Imagine loads of people coming in to carry the baby. You don't know what they wash their hands. You don't know, and then that's how touching the baby's mouth. Okay, daddy, look. It looks like this. Look at gets, thereby exposing that child. Hand hygiene is important. All right. If you say don't carry much, it's your job. Because at the end of the day, you'll be the one to battle it when the child falls ill. All right. But information is key. If you see anything and notice, don't just go and I want to back up. No, go to the hospital. They know better. And they'll listen to you. There are pediatricians waiting to answer to take care of the child. Thank you.
It's so scary that just one touch could lead to something drastic. So, as parents, as guardians, as words, you want to watch out, look out for your children. And yes, I know we've talked about, patient safety where children, where newborns and children are concerned, but it's always important, even as adults, to ask questions. The hospital isn't a playground. So if you ask the right questions, trust me, the doctors are always ready to address whatever questions and help you, walk you through what you need to know. But this is where we draw a curtain today on Smooth Health. Always glad to have Dr. Tobechi Ozuzu in with me.
I'm glad to be here.
But yes, in case Lagos and the world are looking at, okay, I need more information. How can they reach out to you?
Yeah, they can reach out to me on my Instagram handle. Tobeyozuzu. Instagram.
Could you take that again?
Tobeyozuzu.
Okay.
Yeah, you can always reach me anytime. I always respond to your queries, questions. Just hit me up and I'm always there.
So, how are you? I will go. I don't know if consultation is free, but when you reach there, you find out.
Yeah, it's free. It's free.
See? Don't say I didn't help you.
I mean, we need to let everybody understand what their rights are.
Right.
To be able to, because it makes it better. I mean, if everyone knows what to do,
the world will be a better place. All right, Lagos, that's the much we can take today on Smooth Health. You know, it comes your way every Thursday from 5:15. But in the meantime, it's a Thursday, so you know we'll be getting back into the groove of the old music. Well, a mix of old and new. So don't move a muscle. Stay tuned to Smooth 98.1.